Hey, welcome to the conversation that's as diverse as the dogs that we adore. This is Gun Dogs and Guard Dogs, ultimate podcast dedicated to talking sense about dogs with Les Graham and Ross McCarthy. They work with all breeds of dog, but one specialises in gun dogs and the other prefers guard dogs. No flashy trends or social media hype here, just tried and true knowledge that stands the test of time. They bring you valuable insights and honest conversations about the social predator you share your home with. So here we go. About 45 minutes of gun dogs, guard dogs, good dogs, some maybe not so good dogs, and a dash of gossip.
So here we go again, Gun Dogs and Guard Dogs podcast. This week, Mrs. Graham, we are joined again by Dr. Andrew Armitage. And I think we're going to have a little discussion about Librella, the controversial Librella.
Amongst other things as well. Andy, it's so good to have you back. You know, and I keep forgetting to introduce you as a doctor because it's just like, to me, you're just Andy. But of course, it's doctor, isn't it?
Well, well, thank you for inviting me back again. But yeah, the doctor term is vets don't normally be called a doctor because we have a Bachelor of Veterinary Medicine rather than a doctorate. So, but you can be called doctors, but we go more like surgeons that are a Mister. So,
is that just an American thing then, doctor?
Yes, sure.
So with a bachelor, but is it not the same level as a PhD or a doctorate for the bachelor's degree, or?
Well, it is. It's just like a surgeon, a human surgeon is called a Mister. They don't go by the term doctor. So if you, for many years we were all Misters and Misses and Miss, but we can use the term doctor. You know, the Royal College have given us that authorization, but technically,
it's Mister.
Yes.
It's interesting because what you said about doctors, because you know they work really hard to become a doctor, and then they become a consultant and go back to being a Mister.
Yes.
It's like I find it really interesting the way they want to do the whole time they're at medical schools to become a doctor, and then since they're a doctor, they want to go off and specialise and become a Mister again. It tickles me.
If you call them a doctor, they get upset.
I know, it's like you work to get this title and now you've thrown it away, kind of thing. So anyway, there you go, little things that tickle me.
So shall we start on Librella then? Can you just, before we delve into it, what is Librella and what is it used for?
So Librella is a new class of drug that was released in the UK probably 3 or 4 years ago now, and then into America about a year later. And it really is a different class of drug. So it's an antibody. So this is a manufactured antibody that binds to NGF, nerve growth factor. And by binding to it, it removes it and stops it from having its action. So it is a painkiller and it's licensed for use in osteoarthritis. And it's, you know, part of our multimodal approach to painkillers with osteoarthritis, but it doesn't act like non-steroidals like Metacam or opioids like morphine and things. It has a different mode of action because it's an antibody. So to understand, excuse me, how it works, we have to look at what's happening inside the joint with osteoarthritis. So we have joint damage, cartilage damage, and that releases NGF. So in osteoarthritic joints, we have a very high level of nerve growth factor within those joints. And that binds to a receptor in the joint or on the cells called TRK, and that releases something called substance P. And substance P is very much involved in pain sensation, and also it's an inflammatory mediator as well. So what the Librella does, it's an injection. It's once a month, given under the skin, subcutaneous injection, and that's absorbed into the body, and it finds its way into the joint where it binds to NGF and takes, so it stops it from acting. So that in arthritic joints, we've got very high levels of NGF, so it reduces the NGF levels and has quite profound effects on pain within the joint. So it's quite a novel way of approaching things.
Sorry to be a bit dippy as usual. Nerve growth factor. What is that?
So nerve growth factor is a protein that is what's called a chemical mediator or chemical signal. So it's what cells within the body communicate with each other by producing various proteins and what called cytokines and growth factors, and it's how they communicate with each other. So NGF is not just involved in pain sensation and in arthritis. It's found throughout the body and has effects on all different body systems. And it's very important in the fetus or in an embryo in growth and development and formation of the nervous system. But in adults, it also has effects on all sorts of body systems, but it's a chemical signal.
Okay. So presumably Librella affects that across the body as opposed to just targeting the joints.
So basically, Librella will reduce the amount of NGF within the tissues. So it's not selective for joints. So it doesn't just go into the joints and affect that. It goes throughout the body. Now, the thinking was that the Librella could not cross the blood-brain barrier and have effects on the central nervous system.
Okay.
So the brain is, protected by this blood-brain barrier, and it protects, it stops certain substances moving from the blood into the central nervous system. So NGF, if you think about nerve growth factor, the name says a lot. It's involved with nerve growth and regeneration and things, and it's very important in the development of the nervous system. So Librella can't be used in dogs of less than 12 months of age. Shouldn't be used in puppies because it can affect nerve development and development of other body systems as well. So this, we're not selectively removing NGF, but in the joints. But the thought was that I guess it wouldn't remove all the NGF, so it wouldn't have effects on body systems only where NGF is overly produced. But the more we've used it, we are finding some side effects with it that weren't initially apparent. So there's a lot of side effects being reported, and certainly the data sheet for the drug has been updated, and it keeps being updated. This drug has been used millions and millions of doses worldwide since its release, and it was marketed as a very effective painkiller with minimal side effects, and that's led to its widespread use because when we're treating pain and arthritis, we have a number of drugs in our arsenal, and every drug has side effects, so, and Librella is no different, but it's just finding something that works in the particular patient. But because the Librella was thought to be very, very safe, has resulted in millions and millions of doses being administered. And once those doses are administered across a population of dogs, old and young, dogs with other conditions, then, we are going to start to see more side effects than were initially stated in the original trials done for the licensing of the drug.
I think all of those trials and studies and things, obviously they're over quite a short period of time, aren't they? And like you said, it's quite a relatively new drug, and therefore there won't be any data, will there, for long-term use?
Yes, for sure. So there is very strict regulations for licensing of a new medication, and in veterinary medicine, they have to do trials. But the trials that were done in with Librella were in a relatively small population of young beagle dogs in a laboratory setting over a period of months and not years. It's interesting because the drug was originally developed for humans. So many years ago, there was a variety of drug companies that were producing this anti-NGF antibody for treatment of human osteoarthritis. And clinical trials with people are a lot more in depth and a lot go over a lot longer period of time. And the drug was not licensed because what they found in people was that there was this condition that developed in a small but significant number of cases of rapidly progressive osteoarthritis, so what's called RPOA. So this was a rapid loss of cartilage within the joints and exacerbation of the osteoarthritis. So it never got launched as a drug for humans, and then it went a bit quiet, and then they've obviously developed it for the veterinary side now.
Is there any kind of information about that occurring in dogs then? Have we got any information about that, whether that's likely or has occurred or whatever?
So initially we were told that was not seen in dogs. But over the last 2 years, I've seen an alarming increase in number of cases that are referred to me that have been on Librella for some time. And when I do the diagnostic workup, we start taking x-rays, I started seeing some really weird arthritis. So probably, over 2 years ago now, it started as a trickle of cases where I was taking x-rays and I was like, whoa, that is severe arthritis. But then you look at it with a sort of a logical mind, start looking at it, and you're like, that looks weird. It doesn't look normal. And I started getting case after case after case referred to me, and I was finding similar findings. So to try and explain what I was seeing with arthritis is a disease of the joint. You lose cartilage, so you get increased density of the bone around the articular surfaces, and then you get new bone production, so what's called osteophytes. So these, it's the body's response to try and fuse the joint, really restrict its range of motion, and arthritis is a process that once it starts, it's a downward spiral. It just continues, so you will always get progression of the arthritis. But I was seeing cases that we had x-rays of joints before they were put on Librella, and those joints were normal, and now they're very much not normal, and also joints that were already arthritic but have been on Librella for some time, and we're starting to see it's more what's happening around the joint, not in the joint per se. So we were seeing lots of mineralization, so calcification of soft tissues, so tendons and
Wow.
support structures around the joint were turning to bone. So, when you take an X-ray, you shouldn't really see the soft tissues. You're just seeing the bone, and you're only seeing the bone because it's a dense calcified tissue. And so I was seeing that around the joints and new bone formation, but not around the articular surfaces. It was around heading up the bones away from the joint and extending quite far distances away from the actual joint margins. So this is weird, and this is not what you normally see in osteoarthritis. And I guess I've been seeing a lot more cases than others because it's just the nature of the work that I do and the cases that are referred to me. So we get a lot of dogs that have end stage arthritis, and they've had surgeries, they've had physical therapies, they've had drugs and multimodal approach to management of their arthritis, and it's not working. So the owners seek alternative treatments, find out about me, and are referred for regenerative medicine, stem cells, and PRP and things. So I see sort of the worst of the worst. Ideally, I'd like to see the young dogs at the start when they're diagnosed with hip or elbow dysplasia, and we can have a disease-modifying effect with regenerative medicine, stop that arthritis from progressing. But a lot of my work is these end-stage cases. So a lot of these dogs have been on Librella for some time, and initially it worked incredibly well. And they were, pain-free, and it was a miracle drug. And then it stopped working, or the pain came back, or the arthritis was more severe. So then, what's next? You've tried everything else. They come to me. So I think these particular cases are funneled into me. So that's why I see a lot more than maybe your primary care veterinary surgeon.
And what does the arthritis look like if it's away from the joint? Is it are the dogs producing like bone spurs, or?
So it is bone spurs, and I've termed this this new term called Stegosaurus exostosis. So basically,
Okay.
if you think of a Stegosaurus skeleton, and they have those dorsal articular processes on their spine, the really jagged, bony prominences on their spine. That's what it looks like. So instead of arthritis, which generally is new bone formation, but it's smooth.
It's thickening, isn't it?
Yes, and it engulfs the joint, it surrounds the joint. So this is more jaggedy bone that is going up away from the joint, a couple of centimeters away from the joint. And it has this classic dinosaur skeleton type appearance, which is just not seen in normal arthritis. And then we see calcification of soft tissue, so you get these big sort of spurs on side of the joints, but it's not the joint capsule, it's the support ligaments and tendons around the joint turning to bone. So we see a lot of that as well.
Which would be exceptionally painful, wouldn't it, for the animal?
Yes, it's so it's if you've got soft tissue, it has a function and it should be elastic. If it's turned to bone, then it's not flexible or elastic anymore, and it will be painful. And pain from a joint is not just from cartilage damage and arthritis. It's the joint capsule, and it's all the support structures as well. And if you start getting tendon issues, then that can be very painful because the muscle is pulling on the tendon to move the joint, and that's what I was finding. A lot of the pain wasn't really coming from inside the joint. It was coming from around the joint and the support structures. When you look at the joint fluid of these dogs, it wasn't particularly inflammatory. So there is certainly big differences between what we're seeing and what we're seeing in the human trials. So I don't think rapidly progressive osteoarthritis is the correct term to be used in dogs. It's sometimes it is rapidly progressive, but sometimes it's just severe and abnormal, atypical. So there have been dogs that have had one injection of Librella and their joints have collapsed, where it affects the soft tissues and the bone reabsorption, and the joints just melt away and the joints collapse. We've seen spontaneous fractures, so the dog's just walking down the road and the elbow breaks in half.
So there's a Springer elbow, isn't there? My niece is a vet and her Springer ended up fracturing both of her elbows just walking down a ramp.
Yes, so in Spaniels you get something called a HIF, or a incomplete ossification of the humeral condyle. So it's a weakness in between the condyles of the humerus in the elbow, and in Spaniels you can get just spontaneous fractures of that.
So if you have a Spaniel on Librella, that's like,
well, not so much me. I haven't been seeing these elbow fractures because they're not referred to me for regenerative medicine because they've got an elbow fracture. They're going for surgery. So I've only seen a couple of those cases. But there was the Farrell et al. Paper published recently that's gone pretty viral about Librella adverse joint events, and they were seeing a lot of fractures, and talking to the referral veterinary surgeons in the UK, there's quite a few of these dogs that are presenting with elbow fractures, and they're not Spaniels, which is weird because to have an intercondylar fracture in a Labrador is incredibly rare. It doesn't happen, but it's normally an RTA or road traffic accident or some traumatic event. But we're seeing these fractures that are happening just walking down the street, and the dog
goes. It's like terrifying, isn't it, for a dog? I mean, terrifying if you've just started on Librella. The thought that could occur,
it's
terrifying to take your dog for a walk. The slower cases of the cases you mentioned, whereby you see this calcification and the bone spurs and everything else. If people's their dogs are on Librella, is there anything that they can be looking for to moderate? I mean, obviously, that there'll be increased pain or lameness or changes in the symptoms that they were displaying. But is there anything that people could and should be looking for if there's any concern that their dog's been on Librella? It seems to be helping. What can they kind of do to, I don't know, just make sure? I don't know, really. I don't know.
Or even realise there's something gone wrong.
I know exactly what you're saying, because, I mean, don't get me wrong, any drug has a side effect, and this drug has been used, in so many dogs now that, yes, of course, we're going to see side effects, but there's so many dogs that benefit from this drug. I mean, in dogs that can't take non-steroidals, things like Metacam, things for gastric issues, and it has been a game changer. So the important thing is for us to identify the prevalence. How often is this happening? So I see a lot of these cases. I've reported about 50 to the VMD this year, but I'm seeing a skewed population. So we don't yet know the true prevalence of this, but I think the most important thing, this drug is licensed for osteoarthritis. So we have to first start with that diagnosis. So I think it's incredibly important that we perform the appropriate diagnostic tests, so x-rays, on these dogs before they're started on Librella. We need to confirm that is the diagnosis that we've got. I think there's there's a lot of dogs that have been started on Librella for presumed arthritis, but that hasn't been confirmed with radiography or CT scanning. It's been, clinical signs thought to be arthritis, start on Librella. And there is financial constraints, isn't there? In an ideal world, we would X-ray all these dogs to confirm the diagnosis first, but that's not always possible. But I think so. First of all, we need to have a picture of what that joint looks like before we start Librella, and then confirm that it's arthritis and that the drug is appropriate, and then we need to monitor. So I think what I see is with this progression of this arthritis and all this what's called a heterotopic mineralization, so abnormal mineralization around the joint, it causes profound restriction to range of motion. So something that can be easily measured is joint range of motion with a goniometer, a plastic goniometer that you can get off of Amazon for a couple of quid. You can measure the joint range of motion, and that's something I do in all of my patients, because we see such profound increases in joint range of motion after treatment with regenerative medicine, and it's an outcome measure. But that is a simple tool that can be used to monitor range of motion, and if that range of motion is dramatically decreasing, then we need to see what's going on in that joint, so repeat x-rays. And I think in an ideal world, yes, we would be x-raying these joints every 6 months when the patient's on Librella. But again, I don't know whether most owners would be happy for sedation and x-rays every 6 months for their dog, but that's the only way that we can truly sort of monitor for this occurring, because while it is occurring, the Librella is giving such profound pain relief in the joint. So initially these changes can be happening, but the dog may not be showing any deterioration in their lameness or pain state, and then it just gets to a point where they get the mobility is severely restricted, or we have a fracture, or we get tendon involvement.
Would they show a lot of deferred pain, Andy? Because if tendons are calcifying, so say for example, around the stifle, then if that was calcifying, then surely the dog would start getting referred hip pain, because it'd be pulling down.
Yeah, for sure. I mean, if you're getting restriction to range of motion, it can have effects on other parts of the body. It's the same.
So that would be something to be mindful of, wouldn't it? If you put your dog on the bed and all of a sudden you start getting deferred pain, or start getting pain in other parts of its body, it could be because
or any changes in gait or pain state that would flag, or the Librella's not working so much. And I think what some vets have been doing is then increasing the dose of the Librella, or increase the dosing frequency to try and get that pain and mobility
under control
again. But maybe that's the wrong thing to do. And I think if you are getting to a stage where you're like, oh, the Librella's not as effective, then just go back to the drawing board and take those x-rays and get see what's happening.
Would you expect under normal circumstances, so if the dog's on Librella, it's on the correct dose for the dog and the size of the dog and the type of or the level of osteoarthritis or whatever, would you expect that to continue to be effective if it's not going to cause bone spurs and everything else? Would you expect that dose of Librella to be effective for a long period of time, or would you expect sometimes for the dog to require a larger dose? Or does that make sense?
Yes, it does. So I guess it is an antibody, and there is a potential for the dog's own immune system to recognize that as foreign and start having an effect on it and knocking it out. So yes, potentially, and yeah, with arthritis, as I say, disease progression, you might get more and more NGF produced in the joint. So you could expect over time that you may have to increase the dose or dosing frequency, but it has got a very long half-life, so which is how long it persists in the system. So you would have thought with long-term like monthly injections over time, you can get some build up in the system. But I think if the dog had been doing well and starts to show deterioration, then you need to do more diagnostics to understand why.
Yes.
We may have something else completely unrelated, happening or occurring, So diagnostics are very important. I think we need to also, have those x-rays before we start any treatment, because we need to know, and that's not just for Librella, that's for any arthritis treatment. We need confirmation and see what's happening and make sure that it is arthritis and not a soft tissue problem. I mean, I see a lot of dogs with elbow dysplasia, and they've been managed quite well and then suddenly deteriorate. And this is not Librella related. They haven't been on Librella, but they do well and then they start to deteriorate. And it's because you get shoulder tendon issues. So if you've got elbow arthritis, it's really common to get problems in the shoulder tendons, so supraspinatus and biceps tendons and things, and then that can significantly contribute to the lameness. And it doesn't matter what you put in the elbow or focus on the elbow. If you've got a tendon issue in the shoulder, they're not going to get better. And that is I see a lot of elbow dysplasia, and we do a lot of musculoskeletal ultrasound to look at tendons and muscles and soft tissues. And I find degeneration in the shoulder tendons in probably 95% of dogs with elbow dysplasia or elbow osteoarthritis. And that doesn't show up on x-ray unless it's severe.
But it makes sense that it's going to be there. Andy, can I ask you about the brain-blood barrier? So is Librella crossing that?
Well, it shouldn't do, no.
No, but is there? I mean, because I know it shouldn't. I mean, the key is to use drugs that don't cross the brain-blood barrier.
Yes.
But is it crossing?
Before you answer that, can you just tell us what the brain-blood barrier is?
So basically, it's something that keeps the brain's central nervous system separate from the blood. So it protects it from toxins and certain things within the blood. So it's just a membrane that stops.
Like a plug.
Yeah, it's just
a
protection to protect the central nervous system from things within the bloodstream. So Librella should, because it's an antibody, it's a large molecule, and it shouldn't pass across. So if you just think of the blood-brain barrier as a mesh, and only small things can get through, and Librella shouldn't be able to get through. But not just myself, there's a lot of reported side effects of Librella that affect cognitive function, and also there's potential for increased seizures and central nervous system depression, so dogs become depressed. I've seen weird behaviors where dogs become depressed and I've seen dogs that become completely adverse to metal food bowls. Like, this is a weird behavior, like they won't eat, they just won't eat, and won't go near the food bowl, and are just depressed. So that's a central function, isn't it, on behavior. And then you stop the Librella, takes a few weeks to get out the system, 6 weeks, and then those behaviours go away or the seizures stop. Also, we see ataxia, so weakness and incoordination of the limbs, and that is now on the data sheet for Librella as a potential side effect. So it must be getting into the central nervous system to affect motion.
The motor, yeah.
Yeah.
Wow.
But yeah, for sure, there's definitely central nervous side effects which shouldn't happen, but somehow it is happening. So is there in the dogs that it's happening, is there, a problem with their blood-brain barrier? If that is inflamed or something else going on, will that allow the Librella to cross? So it's not happening in all patients. So it's trying to work out, what's the risk factors, which is very difficult because, we need to try and minimize side effects and find ways of identifying, which dogs are going to benefit without side effects and which dogs may be predisposed to a side effect. But that would be very, very difficult to determine, and we need a lot more studies into that to determine it.
Have you noticed anything in your own experience, like breed-wise or age of patient or whatever? Is there any like little things that are forming in your head, or it's just varied?
I mean, 70% of my work is Labradors. So I see a lot of Labradors, and 70% of those Labradors is because of elbow dysplasia. So I see a lot of problems in the elbows. So yeah, you could say, Labradors and elbow dysplasia are risk factors of development, but it's not. It's just that's what I see, and I see the worst of the worst. So it's and a lot of these dogs have been on Librella for some time, and there's a lot of social media hype about Librella, and I think there's a lot of things that are blamed on Librella that aren't related to Librella. And it's very difficult. Like if you're using it in an older dog, they're going to be predisposed to other things. And there's lots of reports of death and things after Librella. But was it actually the Librella, or was something else going on? And it can be very difficult to determine that. And that that's if there's a suspected adverse event, then we should be reporting that as owners and vets, reporting it to the VMD or to the drug company that then is legally bound to report that back to the VMD. So they have a whole department set up to monitor these things. And it can be very difficult to say for sure whether it was the Librella, and a lot of these dogs are on other drugs as well. So, is the Librella going to cause a side effect if they're on paracetamol as well, or Metacam, or something else? And again, that can be very difficult to rule out. Certainly in humans, for the rapidly progressive osteoarthritis, they found that people that were on a non-steroidal anti-inflammatory in combination with an anti-NGF antibody were more likely to develop rapidly progressive osteoarthritis. But it still did develop in groups of humans that weren't on it, and I've seen a real mix. I've seen adverse events in dogs that have been on Librella as a monotherapy. That's the only thing that they've been on, and I've also seen it in dogs on other medications concurrently as well. So it's difficult to
Mm.
it's difficult to you know delve
So,
down into that.
so if my dog got off, I've already been there, done that. But say, for example, my next Labrador gets lame in the elbow, and I go to the vet, and they say, "Oh, we're going to put it on the umbrella." What are the alternatives? I mean, I know I came to you with Emrys, and he's doing amazing. But you know, what alternatives have people got when the vet says to them all, you know, I think your dog's got elbow dysplasia. The first thing would be to an X-ray, but what are the alternative treatments, Andy, other than monthly injections?
So, if we look at the efficacy of pain relief of Librella and compare that with something like meloxicam, Metacam,
Mhm.
and that's been done. There's a recent trial that's just been published comparing the two. Pain relief, the amount of pain relief that you get from it, and the side effects. But again, it was just a short-term study over a few weeks. But what they found is that the pain relief that you get from a non-steroidal, and in this case it was meloxicam, was equivalent to the pain relief that you get from Librella. So Librella is not a better painkiller than Metacam. So meloxicam is a very good pain. All the non-steroidals are a very good analgesic agent, and so yeah, painkillers. If we're talking about elbow dysplasia, do we need to? Yeah, it's important for the diagnostics. Do we need to do surgery on that? Is there a piece of bone floating around in there, or is there something else that you might need to do surgery with? But if you was going down the conservative route, so pain management, then there's a whole variety of drugs available, and weight reduction. Being overweight is so has negative effects, not just because it overloads the joints. The mere presence of fat or excessive fat in the body has a pro-inflammatory state and makes inflammatory conditions worse. So, weight loss is important. Physical therapies are important. We've got laser therapy. We've got intra-articular treatments. We've got platelet-rich plasma, stem cells, hyaluronic acid, joint lubricants. We've got things like Arthramid, which is like a cushioning and helps with the synovium. There's other injectables for the joint. So in America, you can get synovitin, which is a radioactive tin. So it's a radioactive compound that you inject into the elbow, and it is eaten up by macrophages and immune cells, and that are involved in the inflammatory process, and it has long-term effects. So, I mean, we have a massive toolkit available to us and to use. And it's just I go down the regenerative medicine route, and that's what I advocate for, because it has a disease modifying effect. With any drug that you give is just dealing with pain. It's not dealing with the underlying disease process, which is inflammation and degeneration in the joint. And yeah, I would love to, on initial diagnosis of elbow dysplasia, I think the best thing you can do for that dog is inject stem cells and platelet-rich plasma. But I'm biased, maybe.
just little.
Obviously, that has a cost implication as well, doesn't it? To put,
Yeah,
all of that. And if you've got an elderly dog that has just been diagnosed with, arthritis, and we are just looking at pain management, then it sounds like the best thing we could do is to go with Metacam or some other kind of pain relief, anti-inflammatory, etc., rather than going down the Librella route if the efficacy of that is not as good as, if it's the same.
if it's the same. But then, with older dogs, you have other things potentially going on. They may have some kidney disease, and so the vet may not want to put them on a non-steroidal because of that. So I think in older dogs where their quality of life is affected, and you haven't got a reasonable alternative, then for sure Librella has made some absolute miraculous improvements in these dogs. It's just I'm a bit concerned with using it maybe as a first line treatment, especially in younger dogs that are potentially going to be on the drug for years. But in an older dog, if you haven't got any alternatives, then I've used it in that situation, and it can make an absolutely profound improvement on the dog's mobility and pain state. But then you've always got that risk of side effects, and it's a discussion you've got to have with the owner, haven't you? And you've got to it's all about informed consent, and you've got to be able to have discussions about this. Yes, this could possibly happen, but any intervention that we do has potential risks, so it's just weighing that risk benefit up, and having the owners fully informed. I think a lot of the social media backlash about Librella is that it was marketed to vets and owners, and the vets were saying, oh, this is a fantastic new painkiller with no side effects, because that's what we've been told, and that was the evidence that we had at the time when it was released. So then side effects do happen, and then people get upset. So it is all about informed consent, and when it's not appropriate. But that's not just for Librella, that's for any drug that we or any surgery or anything that we do, any intervention, surgical, drug related, has potential adverse events associated with it, and you can't always predict those.
Do you think owners, or is it called white coat syndrome or something, where it's all that deferential, deferring to a doctor and doing what they tell you? Do you think this happens with owners and vets as well, where the vets say, oh, try this, and the owner will just go along with it rather than doing their own research or looking into it or weighing up the options better? Do you think that's happening a lot?
I think so. I mean, you go to a professional, and you take their advice, and I think it is difficult for vets. You've got short consultation times, to go through. To go through every single potential side effect with pros and cons and everything else, you just haven't got the time for that. So a vet will give a recommendation based on their experience and what they feel is best for the patient, and we've got to try and take into account financial constraints and everything else. It's such a complex thing, isn't it? And yes,
I don't envy you. I don't envy you. Definitely not. I think they get it from all angles.
You've got to do all of this in a 15-minute consult. So every vet will give recommendations based on their experience.
But I guess also it's going to be client led, isn't it? Knowing now that that there are various options available. And opening up the conversation, saying, actually, I'm not that comfortable with Librella, or can we try something else, or can we explore something else? For the client to,
Yes, yeah.
I think people have to. Sorry, Andy.
there's not one fix for arthritis. You know, it's multimodal management. And there is a variety of tools we have in our toolbox, but you know, it's got to be a very sort of personalized medicine, so focused on the patient, and the owner as well, and have but there's so many different options, but there's not just one quick fix, unfortunately.
No.
I think a lot of people thought Librella might be that one quick fix, but it's not.
Is Librella being recommended for things other than osteoarthritis, Andy? Or is it purely for osteoarthritis?
Yes, but it's not licensed. It's only licensed for osteoarthritis, but
Okay.
I think it's been used. It's been used for pain in general.
Just general pain relief.
Yes.
Yeah. Okay.
I mean, I saw a dog this week that was diagnosed with intervertebral disc disease and spondylosis. And looking back at those X-rays at the time, I do wonder whether it was started as a discospondylitis, an infection in the disc, because it's not just sort of an arthritic spine. There's a lot of reaction around the disc. Potentially could have been traumatic as well. But anyway, whatever happened 3 years ago, what we're left with now is the spondylosis. But apart from that, the dog had no joint issues at all, and was very healthy. And it was started on Librella for that spinal changes, and the dog did well on that for I think 3 years now, 2 years maybe. It's been on Librella, and then all of a sudden the dog became lame on its right elbow, and so they added in a non-steroidal alongside the Librella, and more recently had intra-articular injection of steroids into the elbow. Still not getting better. Referred to me. So I X-rayed the elbow because hadn't been X-rayed, and which I was quite surprised about. And of course, it's an absolutely classic Librella-induced arthritis in that joint, with extensive mineralization all around the joint in the soft tissues and things.
Wow.
So and that dog had normal elbows. Not that we had X-rays of them, but there was no lameness, no mobility, no pain. It was just pain in the spine. So Librella was used for pain in the spine, and it seemed to be effective. But now,
but it caused calcification in other places.
Is
Right.
this elbow that's got end stage arthritis, and well, it's a mess. And it's going to be very difficult to address that now.
Wow. God, that's amazing. That's really scary, but also quite enlightening. Ross, have you got any other questions on Librella?
No, do you know what? I've got like about 4 pages of stuff and printouts of studies in it, but I think you covered it all.
Can I? I know all we had to do was prompt. Andy, can I ask you a quick question about the conference that you've just been speaking at, please? Okay, because I saw that you've been speaking at the veterinary physiotherapist conference. One of the things you were talking about was gracilis contracture.
Yes.
And I didn't know that was an issue. Is it a big issue? Because the gracilis, first it runs it runs down the inside of your thigh, doesn't it? It's a really, really thin muscle.
Yes. So it's not a big issue, in that it's not particularly common. But yeah, when it happens, it has quite dramatic effects on the gait of the dog. So it's pretty much exclusive in German Shepherd dogs, and it can occur from in other dogs from trauma potentially. But what happens is specifically the gracilis becomes inflamed, and degenerate and is replaced by fibrous tissue. So the muscle becomes all fibrotic, hard and nodular and contracted. The other term for it is fibrotic myopathy. So myopathy means pathology of a muscle.
Would that be related to the physiology and the gait of the German Shepherd specifically?
Good question. It's probably related to genetics as well. So there's probably a genetic predisposition, but the conformation of the German Shepherd potentially could predispose to trauma of the gracilis, sort of repetitive strain type injuries, and it's. I'm just trying. I haven't treated a lot of these cases.
What does it do to the gait? Does it pull them in? Because with humans, when it overcontracts, it can really twist your leg in. What's it doing with dogs? That's why I was really curious.
Oh, I can send you a video. It's a very, very characteristic gait, and just by looking at them walk, you can say that's gracilis contracture.
Okay. Because with us, it kind of flicks with. I know everyone's listening because you can't see it, but when the gracilla gets over contracted, it can kind of really rotate the leg in. Is that what it's doing to the German Shepherds as well? It's rotating the leg in.
So if you think of where the muscles starts and ends, so the muscle attaches to your pelvis, and then it runs down sort of parallel with your femur and attaches just below your
below the knee,
just below the knee.
Below the knee.
So it basically crosses the hip and the stifle. So if you've got a contracted gracilis, basically what that reduces the range of motion in your hip and your stifle. So your stifle can't extend and your hip can't extend. And so when it goes through the swing phase, basically because you can't extend the stifle, you get this rotation of the hock and a quick elastic recoil. So you get this flicking type gait of the hock. So rotation and flicking.
So does it look like string halt in the horse? The string halt in the horse, it kind of swings its back leg out when it's moving, and then it warms up, and then it gets its gait, its normal gait in. But initially, like trying to get a horse with string halt out of a stable is really difficult because it swings its leg out.
Yes, so it's not really swinging the leg out. It's the hock that
is swinging
is rotating because the paw is rotated inwards, and you get this flicking gait, and it's just once you see it, it's just
that's really interesting.
Send us the video. Send us the video.
Yeah, send us the video because I know when you test the gracilis on people, you turn it into contraction, so you're turning the toe in and trying to pull the leg out, and when that goes into cramp, people walk with their feet turned in because it's kind of rotated the lower leg, hasn't it?
Yeah. Okay. It kind of, because the muscle's contracted, it gets to a stop point before it can extend that stifle, and then you get this elastic recoil.
I'd be really interested to see that.
But it's not really swinging. It's not really swinging the hip out. It's more, you sit down at the hock
bit.
Yes. And from the side, you have reduced extension in the hip. So what's interesting about these dogs is I don't think I've treated gracilis just on its own. There's always either hip dysplasia and arthritis, or lumbosacral disease, or lumbar spine deformity. So like an extra lumbar vertebrae or sacralization of the lumbar vertebrae. So I don't know whether it's that predisposes to it, or whether these are just German Shepherds, and they're predisposed to hip dysplasia, and they're predisposed to lumbosacral disease and spinal deformity as well. So are we just seeing all these together, or does one predispose to the other? Haven't quite worked that out, but it's not common to see just gracilis contracture and nothing else going on. But maybe that's just because they're, working German Shepherds, and you have other problems. And iliopsoas issues are very common as well, concurrent because with gracilis contracture you've got reduced hip extension, and then that's going to shorten the iliopsoas and can lead to problems there as well. But the thing with gracilis contracture is there's been no real effective treatment for it. So in the past, surgical transection of the muscle, so you just cut the tendon off, and so that muscle is not functional anymore. But what happens within about 3 months of surgery, you get all scar tissue joining it back up again, and you're back to square one. So other things that have been tried is physical therapy, so physiotherapy, hydrotherapy, and that certainly helps to maybe slow the progression. Shockwave therapy has been used to slow the progression, but there's been nothing to reverse it. There's been treatments with collagenase that basically dissolves the muscle, but it also dissolves the rest of the soft tissues. I wouldn't recommend that. Botox treatments, botulinum toxin going in again.
Do laser treatments not help it? Because laser is great for breaking down calcification and contractions.
I think it'll help slow it, but there's nothing that reverses it until I started using shockwave in combination with stem cells and platelet-rich plasma. So I use shockwave to break down the fibrosis, and then use musculoskeletal ultrasound to inject it into the gracilis muscle and focus around these areas of fibrosis in the muscle, and the tendon all becomes thickened and fibrotic as well, and contracted. So you can inject stem cells into that as well, and then I follow that up with laser therapy, and we normally do 2 treatments of we normally do 3 shockwave treatments and 2 treatments of stem cells and PRP, and we've had really great success in that, in resolving that fibrosis and restoring range of motion to the hip and stifle, and getting their mobility back again, and on ultrasound, we're seeing resolution of the fibrosis and contracture and restoration of the muscle, and it does seem to be long acting. I've had dogs that I treated a number of years ago now that are still absolutely fine. It's never returned.
Wow.
So that's a very promising treatment approach using regenerative medicine. And again, it's we're using something with a disease modifying effect, but you have to hit it hard, and use not just the stem cell. You need to use the shockwave and the laser, and then the dedicated rehab afterwards, to stretch it all out again and everything else.
Was shockwave therapy painful?
Yes, I've done it on myself.
Is it painful?
Yes. There's different types of shockwave, and there's some that are done conscious. In people, it's done conscious, but it's not pleasant. So I use a focal shockwave. So we use what are called trodes, which are connected to the machine, and it focuses that shockwave into a point at a specific depth. So we can change the depth that shockwave is focused into. So for gracilis contracture, we can measure the depth of the fibrosis with ultrasound, and then change our trodes to focus that into the appropriate depth. But it creates acoustic shockwave. So when you're applying it, it's loud. So it makes a sound like that. And typically you're doing about 1,000 shocks at about 360 shocks a minute. So it takes a few minutes to apply the treatment, and it's very loud. And we wear earplugs, and we put earplugs in the dogs, and we sedate, but more often anesthetize the dogs because it's uncomfortable. And the noise as well. Sedation, sometimes with that noise, the dog will, wake up from the sedation just with the noise without even applying the treatment to it. So, an anaesthetic is normally required. But I had a rotator cuff injury and I shockwaved myself. And when you're doing it on yourself, you can really focus it into the sore bit, and it's a weird sensation. It's almost like an electric shock, but it feels like somebody's like tattooing your bone, sort of a vibrating, picking focal discomfort, and it's bearable, but it's not pleasant. There are other systems of shockwave that can be done conscious, and these are just, it's not a true shockwave, it's a mechanical, like hitting it with a hammer basically. So it's not and that can be done if they don't make as much noise, and it can be done in a conscious dog. But for the true shockwave, where you're actually creating an acoustic focal shockwave, that is loud and uncomfortable. I know some people do it conscious in dogs, but I wouldn't.
You wouldn't?
No.
No, my next pet is going to be. I
was thinking about getting it done. Sorry, Ross.
My next pet is going to be a goldfish. This is all just too much.
Yeah, don't blame me.
Andy, where can people go? I know we've mentioned it, but for people listening that want to find out more about you and the work that you do, and some of the studies and stuff, where can people go? So
our website, which is www.stemcellsscotland.co.uk, that has a wealth of information on regenerative medicine and the work that we're doing. I've done a poster presentation on Librella that was at the Veterinary Osteoarthritis Alliance conference back in May, about identification of adverse events with Librella. I must put that on the website, so I will put that on the website. So there's links to that. We're on Facebook, Greenside Regenerative Therapies, and Instagram as well. Any case advice or concerns, you can email us at referrals@greensidevetpractice.co.uk.
And you can follow you on LinkedIn as well, because you as a person, you're on LinkedIn, aren't you?
Yes, for sure. Yeah.
Brilliant. Cool. Well, thank you once again for your time and a fascinating conversation.
I know.
No problem at all.
It's been brilliant. Thank you.
Okay, you're welcome. Thank you for inviting me back.
Thanks for listening. It's not just gun dogs and not just guard dogs, but all things canine, as we hope you have discovered. Please like, share and subscribe, and help us spread a bit of common sense back into dog ownership. And a review wouldn't go amiss either. Catch up with Lez and Ross again in about 14 days for more canine conversations. Until next time, stay well and enjoy your dogs. Any dog-related questions or topics, just drop an email to talk@cfba.uk or message us via facebook.com/gundogs and guard dogs podcast.